Everyone, I'm Dr. Imran. I'm basically a surgical gastro and I do a lot of advanced abdominal surgeries, the laparoscopic, robotic and cancer surgeries. And I'm also in Wockhardt hospital for last 10 years. I'm going to discuss interesting case with you all and with regard to this case, this is a very interesting case as we rarely see certain cases in our practice and this is one of the most rare cases I have ever operated. The patient, it's about the splenectomy and we all know the spleen is a organ, accessory organ of a digestion in our body and it has got many functions. And if we see spleen is a very small organ, it's an immunological organ and it has been placed into the abdomen on the left side upper abdomen. Now this is quite posteriorly placed, which place is normally not accessible and it has got many functions. Basic functions like it acts as a filter. So whatever blood from our body, it goes through a spleen. The spleen is acting like a filter. It filters certain tissues, certain cells, certain bacteria, and it also produces certain products which helps for our immunity. It has got two important functions where we call it as a immune function, where the immunity like to fight with the infections. It has got certain factors where it can produce some immune factors and which helps for the fighting the infections, commonly the viral infections and sometimes the bacterial infections. And it has also got something called as filtration. Filtration where our bacteria, some of the viruses, and death of a blood cells. When we talk about the death of a blood cells means our red blood cells, white blood cells like platelet, hemoglobin and WBCs, they get filtered into the spleen. Those whose the blood cells whose age has been done, like RBCs, the red blood cells has got a life of 120 days and after 120 days they change their shape and size and they come to the spleen and spleen scavenge them or kill them. And so it's like a continuous process. The bone marrow which produces these blood cells and the spleen which kills these blood cells, and there is a good balance between these two is going on in our body from our birth till we die. And when one of the factors get affected, like production happens in a bone marrow or destruction happens in the spleen, which get affected, which can affect the patient. So this is about the basic spleen. It has got many other functions other than the filtration. It also kills the pathogens and it also produces the lymphocytes which helps in building the patient's immunity. So in older kids, in the younger kids, when we are kids up to 12 years of age, the spleen is the most vital organ for the kids because it helps them to fight the infection. In the adults, normally the immunity functions improved and spleen may not remain that important organ, but in the kids the spleen is very important organ because kids are developing and immunity is improving, so the spleen is important organ still 12 years of age. So if you see, it is acting like a filter, and when the blood comes from one of the arteries, as we know there are two blood supply, one is the artery and one is the vein. All the blood is continuously circulating into the body. It comes to the spleen through the arteries. The spleen is like a filter where everything gets filtered and then it comes back to the body by the vein. And this process is going on continuously. And that's why the destruction of the blood cells or scavenging of the bacteria, it is a continuous process going on, especially in the children for the immunity and for the adults for the killing of the blood cells. This is a normal shape of a spleen. It is less than a own hand size of a patient. So if you see your own hand, that should be the size of your spleen or maybe lesser than that. It is an average spleen, and normally it weighs around 170 gram and its length is approximately 13 centimeters. Now this is very important to understand this. The length means it has got a two pole, one upper pole and one lower pole, and along the convex axis we measure the length. It is approximately 30 to 15 centimeters. And with the various infections, this pain can change in the size. And when start increasing in size in various diseases, that's what the trouble starts. This is the record till date. This has been a 45 centimeter size spleen has been removed from Florida, the College of Medicine, USA, on 45 centimeter size, which we were looking for it. And then Guinness Book of World Record has recorded the largest spleen size, which is around 2 feet 5 inches, around 73 centimeter, was removed from USA again in Richmond, Virginia in 2020. So when we are going through this, we were not aware that it is that big, can lead to a world record. But then when we subject it to the pathology examination, and that's what the pathologist has come to us, and he said they have never seen such a big spleen, and we should look into a literature to look for what are the largest spleens available in the world. And that's what we come to it, that it is a 73.66 centimeter size. And we recorded our spleen, it has come to around 90 centimeters, it's around 3 feet by 1.5 feet size. So this patient is with us today. He's a 38-year gentleman, Mr. Rajkumar, and he had basically the spleen has enormously increased. He had these symptoms for going on for last almost 20 years. Patient has been followed with the government hospital, and it has been seen all possible doctors trying to get the diagnosis. What is the cause of spleen is enlarging. Initially, the spleen size was not very high. It was around 25 centimeter to start with. But then recently, last 1.5 year back, it is started increasing enormously. And with that, started with the abdominal pain and swelling. And with this, when the pain started, that time the blood count, the hemoglobin, the platelet count, and WBC count started dipping down, because as the spleen size goes on increasing, it starts killing more blood cells. So normally the spleen kills old cells whose age has been done. But when the spleen size started increasing, it starts killing normal cells also. And that's why this patient has got a massive splenomegaly, and his hemoglobin, platelet count, and WBC count started going down. His hemoglobin used to remain between 5 to 6 milligram %. Normally, the hemoglobin would be around 10 to 14. Hemoglobin is very important because hemoglobin carries oxygen. So the oxygen is the most important vital structures of your body. Oxygen, every cell of your body needs the oxygen and the glucose, especially the brain. Brain cannot tolerate without oxygen. And with the hemoglobin dipping down to 5 or 6, which is like a 1/3 of a normal requirement. So these patients get lethargy, tiredness. They can't do their daily activities because of the low hemoglobin and with that low oxygen saturation. The WC count, again WC count is a fighting marker for our body. Whatever the infections comes, the viruses comes, our immunity is dependent on our WC count, because WCs are various types and they are helpers for our immunity. And when WC count goes down less than 2000, it is very severe, because they are prone to catch infections. And his WC count was remaining around 1300, 1400, 1600, which was much lower than the normal. And the third and most important thing, platelet. Normally we see this platelet count going down, this is like a dengue. But this patient has a platelet count of 1000. Now this 1000 platelet count, where these patients, the platelets are basically used for the coagulation or the clotting mechanism of the body. And platelet count, normally it is 1.5 lakhs to 4.5 lakhs. Now for 1.5 lakhs coming down to 1000, this patient carries the risk of spontaneous bleeding. Spontaneous bleeding means that there can be a spontaneous, without any trauma, without any event, this patient can bleed. With the 1000 platelet, probably they are the indications to give the transfusions. These patients can't be observed because they can have a massive bleed. Why massive? Because the clotting mechanism by platelet has been deranged, and even a small bleed can become so big that the patients can lose their life. And these bleedings can happen in the cavity. Cavities means inside the brain, inside the chest, or inside the abdomen. Sometimes they bleed from the skin, they get blue patches. Sometimes they bleed the urine, or if the females, they bleed their menses. So this amount of platelet count is very crucial and life-threatening. Now what happens? All the 3 cell lines goes down when we call it as a pancytopenia. That means all the cell lines are being down because of a spleen. Spleen is killing them excessively, and that's why all these patients are prone for infection, patients are prone for hypoxia, lethargy, weakness, and the patient carries a very high risk of spontaneous bleeding. Other than that, the spleen, which is a very small organ, has been enlarged enormously, so it started putting pressure on the other organs. I'll just show you the CT scan, and this particular patient CT scan, whole of the abdomen was occupied by the spleen, and it was compression on the intestine, the major blood vessels, the stomach, the liver, everything was compressed because there was no space in the abdomen to accommodate such a big spleen. The second problem happened when the hemoglobin, when they started killing more hemoglobin, the hemoglobin has got iron in it. So this iron, when it's released from the spleen, it has to go to the liver for the process. But the killing rate was so high, that the amount of iron produced was so high, so the deposition of iron was happening to the liver and it was damaging his liver also. So ultimately, because of a spleen overkilling, the liver was getting damaged and he was becoming jaundiced. So because of this massive overfunction of a spleen, he was at a life-threatening situation where there was a risk of a future liver failure, there was a risk of a massive bleeding, risk of infection, and of course the symptoms which are because of a compression, not able to eat, the abdomen was always full, and his mobility has been decreased, and his quality of life was detrimental. So this was the CT scan on that side, and if you can show the left side thing, this left side big thing is whole spleen. So his abdomen has all the organs which are compressed because of this huge size spleen. On the left side, if you see, this is the spleen, and all the intestine, pancreas, liver, kidneys, everything was pushed on that right side, and eventually the spleen goes to the right side also, it covers everything. So spleen, which was essentially on the left side of abdomen, it was going down till its urinary bladder down. So whole of the abdomen had a spleen. So there was no space in the abdomen for other organs to accommodate. So if you see, this is again abdomen, and this spleen starts from here, and it slowly, this is the kidney, compressing on the kidney, this is the spine, this is the blood vessels, and it slowly moves there, and it goes on the left side, and it occupies whole of the abdomen, and the whole intestines are compressed on one side. So there was no space inside the abdomen. And when we see the patient first time, we realize that this spleen has to come out because it is causing detrimental problems to him. So what was the challenge? Challenge was his platelet count 1000. 1000 platelet count and low hemoglobin. This patient cannot undergo surgery because at the incision, on the skin incision, he would start bleeding, and there was no clotting mechanism in his body, no platelet, so he bleed profusely, and no way we can save him. So we have to optimize him. So optimize by giving the blood transfusion, we have to give blood transfusion, we have to give platelet transfusion. But the problem at the spleen is still there inside. As soon as we give the blood or we give the platelets, it will go to the spleen and spleen will kill everything. So we have admitted him 2-3 days prior so that we can optimize him. But it was in vain. It was not possible to optimize him. The spleen was so huge size. We kept giving him blood and the platelet, but as soon as we give him, it will go to the spleen and spleen will kill everything. So his platelet count was remained to 1000, his hemoglobin was remained to 5, and he cannot undergo surgery. So we have to do something called as a special technique where we have to stop the blood supply to a spleen. Now this is very dangerous thing because as soon as we stop the blood supply to a spleen, the spleen starts dying, and when the spleen starts dying, they carry risk of infection, severe pain. It's like an ischemic pain. Whenever you get a heart attack, when there's a blood supply to the blood vessel, heart goes down or stops, you get a severe chest pain. Similarly, this patient, when we stop the blood supply to a spleen, the spleen will be infarcted, it will be dying, and it will be causing very severe pain or carry risk of infection. The blood supply to a spleen, then we transfuse the blood, platelet and other products, and so that it will remain into the circulation, and because the blood supply to spleen is blocked, the blood will not go to the spleen, and these blood products will remain in his body, so that it is helpful for the surgery. So this procedure was done a night prior to a surgery. The surgery was next day morning. This surgery done few hours before, and in the night after we ligate or embolize the blood supply to the spleen, we have given him blood product in the night, so that he will be enough stable to undergo surgery and not to cause massive bleeding. It was a challenging, life-threatening surgery because the spleen was occupying whole of the abdomen, so we have to separate it from many organs, and it was adherent to the many organs like intestine, colon, stomach, pancreas, kidneys. So everything we have to separate it. Again, second thing is when we remove the spleen, as we know the spleen has got an immunological function, it also kills certain bacteria. So we have to vaccinate this patient because if we remove the spleen, these patients carries the risk of post-operative infection. In that 1% patient can die of this infection. So 2 days prior, we have given these two vaccines to a patient, the pneumococcal vaccine and the influenza vaccine, because these are two deadly organisms which can cause life or death to a patient after surgery. So this has to be optimization done, and then this patient had gone for a surgery. The spleen was huge, it was 90 by 45 by 17 centimeter, and this patient has tolerated surgery very well. We did not give any intraoperative transfusions, neither the blood product nor the platelet. Post-operative, we have given him one blood and few platelet, because once we remove the spleen, the body started, now the spleen is not killing anything. There is no spleen in the body. So there is a reactively, the hemoglobin goes up, the platelet count goes up, WBC count goes up, because the spleen which was killing so much, we have removed it, and now the body, there's nothing, there's no spleen, so nothing is dying and everything goes up. So we have to treat that also, because if platelet count goes beyond 10 lakhs, it can lead to the clotting all over the body, and that is again a second problem. So for that, we have to start him on something called as heparin, which is a anticoagulant, and with this complex challenge, we could manage it. This is the angiography, and you can see this the blood vessels, the bigger blood vessels. So these are the coils. You can see that black color thing is the blood supply to a spleen, and these are the coils which has placed into the splenic artery, so that we can block a blood supply to a spleen. By blocking this in the night, then we can give more blood product to a patient, so that it will not go to a spleen, and it will be a result. This was the intraoperative picture. The abdomen, when we opened, the whole abdomen was occupied with the spleen. You can see the side of the abdomen, and you can see the side of a spleen. It was almost occupying whole of the abdomen. And this is the certain steps where we are ligating from the pancreas, from the kidney, and we are separating them out, separating spleen out. So it required a good team of doctors, and it required a lot of time. And at the end, we removed that spleen, which was almost 90 by 45 by 70 centimeter, 8.9 kg weight. What was the cause of it? Why this has happened? And for last 15-20 years, he has been following with the doctors at the specialist unit, and everyone wanted to know what is the cause of it, why it has happened to it. So we removed the specimen and we sent it for the testing, and we have got a diagnosis. I'm sure it is not clear. It is called as splenic histiocytosis. This is isolated splenic histiocytosis, which is a very rare disease, and sometimes it can be a life-threatening, because the spleen increases in enormous size, it overfunctions, and it becomes detrimental for the patient itself. The splenic histiocytosis is a very rare disorder. It has been not commonly reported in India. Amongst the US population, it is very rare. It is 1 in 10 lakh population maybe. And since it is isolated, involved in the spleen, the only treatment would be a surgery, and we remove it. There are other forms of it where multiple systems involved, the liver involved, some gland involved, where we can try chemotherapy, but results are not good. Of course, patient has done a very good recovery. Some pain was there because of a larger incision, but the whole thing has come out of the abdomen. The 8-9 kgs, the tumor has come out of the abdomen. Definitely, he felt much better. Probably we have to observe him. We have to follow him for a good amount of time, because we have to see how he's doing. The spleen, which was over functioning, suddenly you take out that function. So how the body reacts. So we have to follow these patients by doing the blood counts, the hemoglobin, platelet, and everything, and also the CT scan. Everything has been done, and patient has done a smooth and uneventful recovery. He did not face any complication or any challenges post-operatively, and right now he is been before surgery, because of the huge size and all these problems, his quality of life was miserable. But right now, patient currently has joined back to his job and doing all his daily routine activities. So it was basically a multidisciplinary approach. There were a lot of teams of doctors were involved, and the operation was successful because of many factors. Not only surgeon, probably the teamwork was very important. The interventional radiologists, the anesthetists, the intensive care team, the treating doctors, everyone was involved, and it was a big team of doctors which took care of this case. Thank you so much.